Mariana wants to know if
Mhm.
the new capillaries, or, actually, once they start going, these collateral vessels are known as actual arteries. If they can
Mhm.
grow, then can PAD actually get better, even go away? And we know that it's there's no cure, but we have had quite
Mhm.
a few patients that have been told that amputation was the only option, and they just push through, push through, push through, and they have not had an amputation, and they could just continue to walk and push through further and further and further. So it is
Mhm.
possible to stall progression and, move forward with your life, right?
Yeah, and I think this is actually a great point, something I want to address here, being what we call PAD or CLI, critical limb ischemia fighters, is that if anyone is offered amputation as a first option, that is the absolute wrong, unethical thing that should be done here. That means that number one, they're either too lazy, or number two, they don't know what they're talking about. Amputation should never be the first option unless it's in a very, very specific setting where the tissue is already rotten, gangrenous, and it's what we call wet gangrene. There's active infection, and there's no salvage to that tissue. That is the only time that amputation should be a first option. And I'm very passionate about this because everywhere I go, especially in my first practice, this is something I've had to fight with because there isn't a lot of education to this. Even as physicians, and that includes primary physicians and any other specialties also. If they're quick to amputation, that's something to think about, and that's the wrong thing to do. But yes, definitely walking helps you. The walking program has some of the best data and research behind it. That's why it's a class one top list recommendation. Even though you have blockages, does not necessarily mean, especially like not necessarily mean that you have to fix these blockages. And that's why a walking program and these medications are first line therapy before anything more invasive. And a lot of these patients with just walking strengthen those collateral circulation, the reroutes, strengthen the circulation you have left. And a lot of this pain gets better. And a lot of these patients, I've had patients for years to decades, or even never requiring any type of intervention or invasive procedure, even though they have completely blocked arteries.